Take your shoes off for a second. Look at your feet. Seriously, look at them. The color, the shape, the temperature, the swelling. Most people haven't paid real attention to their feet in years. They put socks on in the morning and forget about them until bedtime. Your feet are the furthest point from your heart. They're at the very end of the network that moves blood around your body, the last stop on the train. That makes them the first place to show visible changes when something is going wrong with your heart, your kidneys, your blood sugar, or your blood flow. They're like a dashboard light that most people cover up with socks and never check. A patient of mine named Walter, 69, came in for a routine visit. He mentioned, almost as a joke, that one of his ankles had been swollen for a few weeks. He figured he'd twisted it without noticing. That swollen ankle turned out to be the first visible sign of heart failure. His heart had been weakening for months, and his feet knew before he did. I'm Dr. Gray. Every week, I break down the silent health risks after 50 in the simplest way possible, using real examples and zero medical jargon, so you can protect your health without needing a medical degree. Your feet carry your entire body weight every day, but what they can tell you about your health is worth paying even more attention to. Changes in color, temperature, sensation, and shape can point to heart disease, diabetes, blood clots, and circulatory problems, sometimes months before any other symptom shows up. The problem is that most people over 50 blame every foot complaint on aging, bad shoes, or standing too long. And by the time they bring it up to a doctor, the condition behind it has been quietly getting worse. Today I'm showing you 5 warning signs your feet are sending right now that you should never brush off after 50. Most people think of their feet as the least important part of their body. They're just down there, doing their job. Your heart gets attention, your brain gets attention, your feet get socks. But here's what makes your feet so useful as a health indicator. They sit at the very bottom of your body, farther from your heart than anything else. Blood has to travel all the way down, then fight gravity to get back up. So your feet are the first place to show visible changes when your heart loses pumping power, when your arteries narrow, when your blood sugar damages tiny vessels, or when your kidneys stop handling fluid the way they should. Think of your body like a tall building with water pressure. The penthouse, your brain, gets priority. The ground floor gets whatever pressure is left over. If something is wrong with the plumbing anywhere in the building, the ground floor shows it first. That's your feet. A study in the Journal of the American Heart Association found that swelling in the lower legs was one of the earliest visible signs of heart failure, showing up in many patients months before they felt short of breath or any chest tightness. The warning was right there at the end of their legs. They just weren't looking down. Sign 1. One foot or ankle is more swollen than the other. If both your ankles swell a little at the end of a hot day and go back to normal by morning, that's usually just gravity doing its thing. Fluid settles when you're on your feet all day. Normal. But if one leg or ankle is noticeably puffier than the other, especially if it came on over a few days and doesn't go down after a night of sleep, that's a different situation entirely. One-sided swelling is one of the earliest signs of a blood clot forming deep inside a vein in your leg. Doctors call it deep vein thrombosis, or DVT. All that means is a clot stuck in one of the larger veins in your leg, blocking blood from flowing back up the way it should. Think of it like a dam forming in a river. Water backs up on one side because something is blocking the flow. That's why only one leg swells. The clot is sitting in that leg, and the fluid has nowhere to go. Here's why this one is urgent. If that clot breaks loose, it can travel through your bloodstream and get stuck in your lungs. That can kill you within hours. One swollen ankle that you assume you bumped into a coffee table, that could be the difference between catching it early and ending up in an emergency room. If one ankle is visibly bigger than the other, and it's been that way for more than a day or two, get it looked at. Don't wait. Sign 2. Both feet are swollen and it's been getting worse. When both feet and ankles puff up and stay puffy, especially if the swelling has been creeping up over weeks or months, your body may be telling you that your heart is losing its ability to push blood around the way it should. All edema means, in plain English, is that fluid is leaking out of the tubes that carry your blood and settling in the lowest point of your body because your heart can't pump it back up fast enough. Picture a sump pump in a basement. When the pump works well, water gets pushed out before it collects on the floor. When the pump starts to weaken, water pools. Your heart is the pump. Your feet are the basement. Walter, the man from the beginning, had exactly this. Both ankles getting bigger slowly over weeks. He bought wider shoes and moved on with his life. His heart was quietly failing the entire time. That ankle swelling showed up months before he felt out of breath, months before any chest pressure. The first warning was sitting right there in his shoes, and he almost didn't mention it. Here's what nobody tells you about heart failure. Most people picture a dramatic event, clutching your chest, collapsing. But heart failure usually creeps in gradually. Your heart doesn't stop all at once. It weakens over time, like a battery slowly losing charge. And the first sign isn't in your chest. It's in your feet. Sign 3. Your feet are cold when the rest of you is warm. Cold feet are so common that most people treat it like a personality trait. I just run cold, always have. But if your feet feel noticeably colder than the rest of your body, or if one foot is consistently colder than the other, blood may be having trouble getting down there. The most common cause after 50 is peripheral artery disease, PAD. That means the arteries carrying blood to your legs and feet are slowly narrowing from the same fatty buildup that causes heart attacks in the arteries around your heart. Think of it like an old pipe gradually clogging with scale. Less and less water makes it through, and the faucet at the end, your feet, barely runs. About half the people with PAD have no idea they have it because it sneaks up so gradually. Cold feet, legs that feel heavy after a short walk, skin that looks a little paler or shinier on the lower legs than it used to. They chalk it all up to age. Meanwhile, the same narrowing happening in their leg arteries is very likely happening in their heart arteries too. Same disease, different location. Your cold feet might be telling you that your heart arteries are in trouble too. But I'm not done yet. PAD doesn't just increase your risk of losing circulation to your feet. People diagnosed with PAD are 4 to 5 times more likely to have a heart attack or stroke than people without it. Cold feet aren't a comfort problem. They're a warning about your heart and your arteries. Sign 4. Numbness or tingling that shows up and won't leave. You're lying in bed at night and your toes feel like they're buzzing. Or you step onto the bathroom tile in the morning and you can barely feel the cold floor under your feet. That pins and needles feeling that used to only happen when you sat in a weird position is now showing up on its own for no reason and sticking around. That can be an early sign of nerve damage from high blood sugar. Here's what's happening in the simplest terms possible. When blood sugar stays too high for too long, months, years, it eats away at the smallest tubes carrying blood in your body first. Those tiny tubes feed the nerves in your feet. When the nerves lose their blood supply, they start misfiring, sending burning, tingling, or numbness signals, even though nothing is actually touching them. Think of it like a lamp with a frayed wire. The connection is damaged, so the light flickers on and off unpredictably. That's what your nerves are doing. Here's what nobody mentions. Nearly 1 in 3 adults over 65 has diabetes or prediabetes, and many of them have no clue. That tingling in your feet at night can be the very first sign, showing up before a blood test ever catches a problem. Before the thirst, before the blurred vision, before any of the symptoms people usually associate with diabetes. Your feet were already telling you something was wrong. If your feet have been doing this for weeks and you've been blaming your shoes or your mattress or the way you sleep, get your blood sugar tested. It takes 1 appointment and 1 blood draw. That's it. Sign 5. Your calves cramp when you walk and stop when you rest. This is the sign that gets explained away the fastest. You're pushing a cart through the grocery store and your calves start aching. You lean on the cart for a minute, pretend to read a cereal box label while you wait for the pain to pass, and it fades. You keep walking, it comes back. You stop again, it goes away again. You figure you're out of shape, or you need better shoes, or maybe you overdid it yesterday. This stop and start pattern has a specific name in medicine, intermittent claudication. But what it really means is that your leg muscles are starving for blood while they work. The arteries feeding them are too narrow to deliver enough oxygen when you're moving. When you stop, the demand drops, the muscle gets enough blood to recover, and the pain eases. When you walk again, demand goes back up, and the muscle cramps because it's running on empty. Think of it like trying to run a garden sprinkler through a hose that's half clogged. There's enough water when nothing else is running, but the moment you need full flow, it chokes. This isn't being out of shape. This is peripheral artery disease, the same condition that causes cold feet and the same plaque buildup that narrows arteries around the heart. Those grocery store cramps aren't a fitness problem. They're a warning from your entire circulatory system, and the people who catch it from this symptom instead of ignoring it for years are the ones who get treatment before it turns into something they can't walk away from. Here's your prescription. Tonight, take your shoes and socks off and actually look at your feet. Check the color, the temperature, any swelling, any differences between left and right. If one side looks different from the other, that's always worth mentioning to someone. This week, if you recognized yourself in more than one of these signs, call your doctor and be specific when you describe what's going on. Don't say, "My feet bother me." Say, "I have swelling in one ankle that's been there for 2 weeks," or "My calves cramp every time I walk more than 5 minutes and the pain stops when I sit down." Specific descriptions get specific tests. Ask about an ABI test. That stands for ankle brachial index. All it does is compare the blood pressure in your arm to the blood pressure in your ankle using a regular cuff, just like a normal blood pressure check, but on 2 spots instead of 1. If the numbers don't match, it means blood is having trouble reaching your legs. Takes about 10 minutes, completely painless, and it screens for peripheral artery disease, the condition behind cold feet and those walking cramps. And if you have diabetes, check your feet every single day, between the toes, the soles, every spot you can see. Catching a problem early is the difference between a simple treatment and a serious one. Walter, the man with the swollen ankle, got lucky. We caught his heart failure early enough to start treatment before serious damage set in. He takes medication now, watches his salt, and his heart is holding steady. He told me he almost canceled that appointment. He almost didn't mention the ankle because he thought it was too small a thing to bother a doctor with. That's the part I want you to hold on to. Your feet are talking to you every single day. Most of what they say is routine. Tired after a long walk, stiff in the morning, sore after wearing the wrong shoes. But every once in a while, mixed in with all that ordinary noise, there's something that means more. A cold spot that doesn't warm up, swelling that doesn't go down overnight, a buzzing in your toes that wasn't there 6 months ago, a cramp that only shows up when you move and vanishes the moment you stop. You don't need a machine to catch these things. You don't need a lab. You need to take your socks off, look down, and pay attention to what's been changing. One look, one conversation with your doctor. That's all it takes. Now you know. The rest is on you.